really seen the local Barrie community, Innisfil, and all of the county of Simcoe really rally together when it comes to securing supplies for our frontline workers. As a province, we've really been very innovative in terms of how we secure supplies. As you've seen with 3M, we've been able to secure a substantial amount of N95 masks, about 500,000 masks, and we've been securing masks, surgical masks, and any N95 masks to send across our communities. And we've come to the point where the turnaround time has been within 24 hours, which is exceptional, so that when people have a need and they're short on supplies, we're able to get it to them as their provincial government responsible for healthcare. And through Ontario Together, the website the provincial government has launched to ask businesses to retool their manufacturing to produce masks, ventilators, gowns, gloves, hand sanitizer. We've seen over 14,000 submissions on the Ontario website, which is incredible. And many of those include local businesses here in Barrie. We know of Innovation Automation, who is working to create personal protective equipment. BroTech is also in that field. We've seen Georgian College stepping up to the plate, Napoleon stepping up to the plate. So we really have, made in Simcoe County solutions to this pandemic as well, contributing to the efforts. We owe it to all seniors in Ontario to pay them the respect and dignity they deserve, because many of the freedoms we hold today is because of them. So the Premier of Ontario has a high respect for our seniors, just as I do, and it's just it's the way that we were raised. As a province, we've launched an action plan to help all of our long-term care homes and senior homes in this province. What we've seen to date happening is deplorable, and we want to be able to react swiftly as a government to bring in the resources that are needed. There are naturally, there are going to be some hurdles we have to cross, as there are obviously areas where the government has a say and a hand, and then there's times where we have to work collaboratively with the private sector. So this is really a call on the Premier's part, and as a province, for us to really, pay the respect we need to our seniors. We've seen under COVID-19, seniors are the most vulnerable population, which is why one of the swift actions the provincial government took was to create an iron ring around our senior homes and long-term care homes. But we're not going to stop there. Many supplies are being given directly to senior homes here locally in Barrie. We've seen many efforts and communities coming together to donate supplies as well to our senior homes. But it's not going to stop there. The province and the Premier have made it very clear. The action plan is designated to be very preventative from having any sort of other issues come up in our senior homes, so that families who are at home right now that have a loved one who happens to be at a senior's home can have more assurance and peace of mind that their loved one is taken care of. So one of the key components of our senior homes and long-term care homes is the staffing and the resources. And what you've seen through a lot of the efforts that the province has been making and through the extra additions of the new action plan for senior homes is the staffing resources. Currently, there could be a worker who is at one senior's home and they could be working at 2 to 3 different senior homes. That's the reality sometimes of their contract or their employment. And so we're dealing with some of those hurdles in terms of the contractual obligations. But of course, there's the safety obligations that should, in this pandemic environment, trump it, which would mean that individual worker would only be able to work at one home, not multiple homes. This is something that's happened in hospitals too, where some nurses may work at more than one home. In order to change that, it would have to be something the province designates. What we've heard from the healthcare sector is they wanted flexibility. I'm speaking specifically to hospitals. They prefer the idea of being able to redeploy the nurses as necessary, which would mean that if the hospital has a surge and they need nurses, they would pull them from wherever necessary for them to be on the front line in the hospital. That could entail them being pulled from places like long-term care and senior homes. So when we're developing these types of policies of saying you can only work at one area,
We just have to be mindful as a province that we're not pulling away resources from places where we may critically need them at one given time. So it's not an easy solution, but if it was easy, everyone would do it, as the expression goes. So we're going to be working with the different personal support worker groups that manage a lot of these employees, and of course the senior homes, to come up with ways that we can get through this pandemic and create an action plan where we are obviously taking into account the safety of the workers in the home, but also the individuals who reside in it as well. And that may require pulling in more staff per senior home. And certainly that's something the province is ready to get dedicated to have more staff in senior homes, something we dedicated at the beginning of this pandemic. And certainly we're shifting to an increase in the amount of staff that we dedicate per shift. We also put out a call to anyone who happens to be a retired nurse or has some sort of credentialing in nursing. We put out a call as a province to ask those individuals to apply and to get back into nursing. So there might be individuals whose full qualification, they may not be able to be in, say, the emergency room, but they might have enough qualification to do some sort of testing or assessment or what have you. So we're also going to be pulling on those individuals as well, those who have some level of credentialing, whether they're just fresh out of nursing college, and then those who've also retired. And that's how we're going to call on all Ontarians to double up the workforce efforts to fight COVID-19. When the COVID-19 pandemic first hit, the provincial government did dedicate $20 million specifically to supporting a lot of our senior homes, and that's specific to supplies. Additional money was given to long-term care homes and senior homes for other measures, and so the finances were there from the provincial level. Now what we really need to do is dabble down on how do we get now that they have the finances, and now the finances have increased since the economic statement, how do we get the people power to the front lines? And so a lot of that is staffing. And so that's why the province does have to pull on nursing staff who might just have graduated or might ask them to come out of retirement, because while the financial aspect of this the province has committed to, you can't really buy a nurse who hasn't been credentialed and put them in the front lines. That's something money can't buy in this day and age. But what we can do is we can encourage others to come out of retirement knowing that we are able financially, the ability to give them work, and likewise those nursing students being able to put them into work right away. That's manageable, and that's something we can do, including giving them the supplies they need. But it's all hands on deck, and it's something that we've got to work in tandem to solve. As we know, yes, a lot of the outbreaks have been happening in clusters, and the outbreaks have been targeting, unfortunately, senior homes, and we've seen what happens and the terrible consequences of it. So the beginning of all of this, the province did put in an iron ring around long-term care homes and senior homes. That was step number one. Obviously, putting the funding in for supports and supplies was step number two. Now we're expediting a lot of these efforts, and step three is an aggressive action plan to learn from some unfortunate consequences that have happened in senior homes and how we can, as a province, prevent it and help our seniors. This time of COVID-19 has really proven how all governments are working collaboratively and quickly to get a lot of measures passed through quickly. We've seen with a lot of the emergency measures that have been passed at the provincial level, it's been supported by the Green Party, the NDP, the Liberal. This COVID-19 doesn't discriminate across borders, but it doesn't have partisanship either. We've got to work with all levels of government. We've been working closely at the municipal level as well. As we know, we gave them about $1.8 billion to help them offset property taxes for residents and businesses. And so that's a huge help to municipalities. It's some cash flow for them, but it's cash flow, more importantly, that they can pass on to residents and businesses. So you've seen that collaboration at the federal level. Our provincial government's in constant contact with our counterparts when it comes to what we need to do to help families and what we need to do to help businesses and what we need to do to help secure more personal protective equipment. We're using bulk purchasing power at the federal level, which allows us as a province to secure more supplies at a better rate. So we're doing that with our federal counterparts, and that's how we've been able to secure many of the ventilators and the amount of masks that we've been able to secure. Just in the past few days, we've been able to deliver 6.5 million surgical masks to about 650 different providers across the province. And so the supplies are getting out there. It's just making sure it's a very much a coordinated approach and that they're getting to the people that need them the most. So you've seen that collaboration really happening. And the best part is it's not just government stepping up to the plate, it's individuals and them going out to help, whether it's delivering meals to our frontline workers, encouraging other people to deliver meals to our frontline workers, or coming up with campaigns. We've had a campaign of local photographers here in Barrie where they went and encouraged people to donate to the local food bank. And in return, you get a picture that you can share with your kids, your grandkids, and your family to remind you of what happened in this pandemic and how we did survive and we got through it. So you've really seen those really grassroots efforts. You've got farmers markets here in Simcoe County that are doing a lot of sales over the phone and keeping people healthy with fresh produce. And so all those efforts kind of make this like an interesting time, because while we're all separated, humans are still going to find ways to come together and help one another. So as part of the extension of the emergency measures the provincial government has done, it includes a few additional elements. For example, OSAP deferrals, they are now deferred until January 1st because we understand that a lot of students aren't able to get the summer jobs they normally would to able to save up for school, but also this is their future and they're our next generation of leaders in this province. And so if we can help them out, we will. So they have till January 1st for that. The Canada Summer Jobs Program is still open at the federal level, so students can apply for that, and it gives them the ability to have employment during this period of time. We'll have to get creative with how that works. And the other thing the province has passed in the Emergency Measures Act is a little more cash flow for municipalities through the Planning Act and the Development Charges Act. So it allows municipalities to still charge development fees even though construction isn't going on. And so it allows them to have a little more cash flow to help with COVID-19 efforts. We will all get through this. There is light at the end of the tunnel. Stay positive, and remember, there are things that you can do to help quash this pandemic, which is washing your hands, exercising, physical distancing, and trying to stay at home as often as you can. We will get through this.